Good afternoon, ladies and gentlemen. And we are most appreciative of having you back. We do appreciate your attention and participation. We have today, as normal, as usual, the last Sunday in the month. We always devote that to health needs, whether it's physical health or if it is mental health. And today we are going to spotlight the mental health. So we have our resident counselor in place in Miss Alicia Richardson, who is the counselor and CEO for Heart of the Matter Counseling. So the next voice you hear will be Miss Alicia Richardson, who will bring us some very helpful information. Thank you.
Well, thank you, Miss V. Thank you so much. It is so great to be with you all again today. And today I want to take the opportunity to share and inform you that April is Sexual Assault Awareness and Prevention Month. By having the discussion and bringing awareness, we can help promote healthy and positive relationships that are based on respect and safety. We must have these conversations that continue to inform and raise awareness because sexual violence impacts everyone, either directly or indirectly. Sexual violence impacts families, communities, and neighborhoods. Sexual violence is sexual activity that takes place when consent is not given and impacts the health and well being of the survivor. According to information that I found on the United States Drug Enforcement Administration website, every 73 seconds in America, an American is sexually assaulted. And every 9 minutes, that victim is a child.
Hmm.
More than 1 in 3 women and nearly 1 in 4 men experience sexual violence involving physical contact during their lifetime. The consequences of sexual violence can be both physical and psychological. The physical consequences can be bruises, an injury, and an example of psychological consequences can be depression and anxiety. Sexual violence is a trauma that can disrupt the life of the survivor. And there are rape crisis centers in every state. Rape crisis centers provide confidential assistance for the survivor. The assistance includes advocacy and an advocate that will accompany the sexual assault or rape survivor during medical exams and law enforcement interventions. The Rape Crisis Center will also provide education, follow up services, and referrals to other resources in the community, as well as counseling sexual services. Counseling service for sexual survivors of sexual assault and or rape. And in our community in Mobile, we have the Rape Crisis Center. And in Baldwin County and in Escambia County, we have the Lighthouse. And those numbers are listed if you should have need of their services. So also, as I continue the conversation, we're moving to a different subject matter now. As I continue the conversation about mental health and mental illness, I want to remind you of the effort to destigmatize mental health and mental illness. For far too long, individuals have been shamed or have felt shame for their behaviors due to stigma, and therefore they did not seek support. We must recognize and address the disparities of health for people of color. It is likely because of these disparities and other events that have happened in communities of color that people of color have mistrust in the helping communities. Because of the mistrust, many people of color have not sought support. They may have wanted to seek help, but because they recognize their own behaviors, but because they did not trust, they did not seek the help that they needed. As I speak to you today, I want to encourage you to reach out and seek support. You do have the right to seek a goodness of fit. If an individual has a diagnosis, they have a diagnosis. That's what it is. But
Mhm.
how you handle the diagnosis makes the difference. And know that all individuals have the right to be treated with dignity and respect. I also want to remind you that mental health includes our emotional, psychological, and social well being. Our mental health affects how we think, how we feel, and how we act, and helps determine how we handle stress, how we relate to others, and how we make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Many factors do contribute to mental health problems, such as biological factors such as genes, life experiences such as trauma or abuse, family history of mental health problems. I believe that what has happened to an individual supports how the individual not only views the world, but how that individual interacts and behaves with others. When I talk about mental health, I am referring to an individual's ability to cope. Mental illness is a disorder that causes psychological and behavioral disturbances. Mental illnesses are common in the United States. Nearly 1 in 5 adults live with a mental illness, and that was 52.9 million adults in 2020. Mental illnesses include many different conditions that vary in degree of severity, ranging from mild to moderate to severe. A mental illness can make you miserable and can cause problems in your daily life, such as at school or work or in relationships. And such examples of mental illness would include depression or anxiety disorders, schizophrenia, eating disorders, addictive behaviors. However, in most cases, symptoms can be managed with a combination of medication and talk therapy, which is also known as psychotherapy. As a mental health clinician, I practice with the wellness model mindset. My initial approach is to approach my client with the mindset of what has happened to you as opposed to what is wrong with you.
Yeah.
Mental illness can be in our biological makeup, meaning that we can be predisposed to some mental illnesses, such as bipolar disorder, schizophrenia, depression, which are three of the most common talked about mental illnesses. But today, I was asked to address manipulation and narcissistic personality disorder in our mental health talk. First, I would like to say that manipulation is a form of control. If an individual believes they can control others, I believe that is a learned behavior. Most people may not recognize or acknowledge that they are being manipulative because that has become their way of surviving. Some signs of an emotionally manipulative person may be that they twist the conversation around and things are said to make others feel less than or feel bad. They can also use emotional or guilt trips to control people and minimize the differences or problems so that they don't have to be there for you. And a person who is emotionally manipulative is an expert at using passive aggressive behaviors towards
Mhm.
others and will focus their attention not only on their own unhappiness, but they never acknowledge your pain. Manipulative behaviors can negatively impact relationships and create unhealthy relationships. And most time, an individual that may be manipulative may tell the other person, the one that's being manipulated, that they're not being manipulated. And they may believe wholeheartedly that they are not the problem, but you are. So I do encourage individuals that are experiencing difficulty relating to others and are experiencing depression to seek the support of a trained behavioral or mental health specialist. If you choose to do this, you can sit down with someone trained in a confidential space. One of the things I know is that if an individual never acknowledges behaviors, they will never change their behaviors, and their surroundings and things will stay the same. Today, my disclaimer is that I'm sharing information that I have researched. The information that I am sharing is no way a diagnosis, but I do encourage you, if anything that I should say should resonate with you, that you seek the support of a trained mental health therapist or behavioral health therapist. Do a sit down one to one to determine if further support could be helpful to you. So, as we discuss narcissistic personality disorder, I do not believe that narcissistic personality disorder is rooted in our biological makeup, but more so, it is developed through our experiences. I believe it is a disorder, it is a mental illness that develops because of an individual's life experience. Our biological makeup does not portray that we are better than anyone else. But the individual with narcissistic personality disorder may portray that they are better than others, but in fact, they may be experiencing low self esteem. And as a result, an individual with narcissistic personality disorder is not one that might immediately seek support because most individuals with NPD, narcissistic personality disorder, might believe that they are fine and others are the one with the problem. An individual with narcissistic personality disorder may think that everyone else is wrong. And when certain belief systems are developed, it is very difficult to change those belief systems when they are challenged without hard facts. When our belief systems are changed, we must have those hard facts to get us to even consider a different way of thinking and believing. Individuals view the world through their lens, often identified as their internal working model of how they see and how they interact with others in the world. And although I am not focusing on the attachment style today, I want to give the for instance. One of the theoretical frameworks that I ascribe to is called the attachment theory, which in my own words, it's how I am treated from infancy helps me to shape my viewpoint of others. It helps me to
Mhm.
shape my social and emotional strength. One example might be if adult caregivers do not meet the needs of a young child, the child may grow up to believe that no one can meet their needs and they become self sufficient and they may lack trust of others.
Mhm.
Narcissistic personality disorder is a pattern of grandiosity. It's a need for admiration and a lack of empathy. It can be characterized by a pattern of exaggerated feelings of self importance and excessive craving for admiration and a diminished ability to have empathy with others, other feelings. Narcissism is a mental illness disorder. The cause is unknown, but it could be a result of life during childhood, excessive pampering, and criticism.
Mhm.
The complications of narcissistic personality disorder can include relationship difficulties, problems with work or school, depression, anxiety, physical health problems, the misuse or use of alcohol or substances, and even suicidal thoughts or behaviors. Now, one of the reasons we bring awareness is to inform. Narcissistic personality disorder is a mental condition in which people have an inflated sense of their own importance and a deep need for excessive attention and admiration. And an individual that has been diagnosed will often experience trouble in their relationships. And as you can imagine, when you hear that the behaviors that I've listed before, a person with narcissistic personality disorder may have difficulty fostering and struggling in maintaining healthy relationships. There is support available for a person with narcissistic personality disorder, but you would seek a person that is certified to treat mental illness, a behavior or mental health specialist. However, remember, before anyone can receive support, they must acknowledge they need support. The old saying is, you can lead a horse to water,
Yeah.
but you can't make them drink.
Mhm.
You can identify the behaviors of narcissistic personality disorder, but if you don't want the support, the person or the individual may continue to have struggles with their daily life. And if untreated, it could experience a disturbance in their social relationships that take place in their home, the relationships that take place in their school, as well as on their job. So today I've given you just a little snippet of narcissistic personality disorder. And hopefully you understand there is a difference between narcissistic personality disorder and manipulation. And also remember that how we treat people is extremely important, because each interaction helps us to shape how we view the next person. As unfair as that might be, that's what we tend to do. So thank you for allowing me to share with you today.
Okay, thank you. We do appreciate that. And we do have a few questions if you have the time.
Yes, ma'am. I'll do
Yeah.
my very best, Ms. V.
Okay, thank you. Well, thank you. We appreciate that. And you
Yes,
always do anyway.
yes,
Um,
ma'am.
as far as the narcissistic personality, what would you say would be the typical treatment for that particular disorder?
I would say psychotherapy, that's talk therapy. That would be sitting down with someone who is a trained mental health clinician. Um, and when I say treatment, that's, sitting down and having the conversation. The individual has to be willing to do the work, which can sometimes be really difficult when we are looking at our own self in the mirror.
Yes.
It can be really difficult, because again, a person with narcissistic personality disorder, it's not about them, you're the one with the problem.
Mhm.
But if an individual gets to a point where life becomes challenging, the relationships, they're tired of the relationships, um, that they are having are difficult, then they may say, I need to sit down with someone. And even that would be a challenge, because when it's almost when we get set in our ways, when we get set in our way of believing and our thinking, then it's really difficult for someone to convince me that what I'm thinking is incorrect.
Mhm.
And
Exactly.
so it becomes, I would say it becomes a beautiful dance. It becomes a relationship that is fostered between that therapist, the mental health therapist, clinician, and the person with the narcissistic personality disorder, because trust has to be established. And when I talk about me coming from a place of wellness, as we're looking at what has happened to you to cause you to develop the ways that you think, the patterns of thinking that you have. Because I mean, we come here as almost like a sponge.
Mhm.
We come here and we absorb the experiences and create an opinion around those experiences, you see.
Yes.
And so when we have, and that's why I, brought in the theory of attachment, because how those adult caregivers are with us as young children shape our way of seeing,
Mhm.
viewing, and interacting with the world.
Yes.
And
Mhm.
so, again, as you heard that with narcissistic personality disorder, it could be that extra pampering that made me feel like I was better than others, that I'm, I get everything I asked for and you're beneath me. Or it could be that constant criticism of you're not worth anything, you have no worth, or you're going to be like this person or that person who they've already identified or saw you judge in a negative way.
Yes.
And so it helps them to shape their thought process and how they're going to engage with others. And so you see, and again, it's so important that when we see these behaviors that we don't necessarily, because we have a tendency to say, oh, this is the behavior and here are some behaviors and symptoms of narcissistic personality disorder, therefore you must be. And that's not necessarily the case.
No.
A diagnosis is only given by someone who is trained to give a diagnosis based on diagnostic criteria. And so that's part of where this stigma comes from, is because we are so loose and so quick to judge that we make people feel shame for doing the things that they do, feeling the way that they feel, and they shut down.
Yes.
And they don't seek out the help that they need or the support that they need. I think it may have been about 3 or 4 months ago, I really had an epiphany. And it was personal to me, but I began to think about, some of the behaviors that I see as a result of the words that have been spoken over people's lives.
Yes.
We have a tendency to say negative, hurtful things and expect the person to come out well and do well, when in fact they don't know what well looks like or feels like, because they haven't had that example for themselves set for them.
Yes.
So, my encouragement to the listeners today is to really be mindful of the words that we speak over others, to be mindful of how we interact with others, because our interactions do matter. They matter a great deal. And especially those interactions with young children who are shaping and forming their view of the world. We just need to do things differently. When you look at the news, that's a prime example of why we need to do things a little differently.
Yes, that's true. That's true. Very good. Thank you for that explanation. Now, getting back a little bit to the violence, the sexual abuse and sexual violence. Is there such a thing in a case, domestic violence? Is there such a thing wherein the person, be it the male or the female, ends up, I know this is a little off target because it's off your topic, not really what you was speaking on today, but is there such a thing as the person actually staying too long in that relationship?
Wow, that's a powerful question, Miss V. And I say, because when you're looking at domestic violence, I want to say, how do I answer that? When you are in a unhealthy relationship, how about that? When you're in an unhealthy relationship, it is so vital that you recognize that. Unfortunately, there are many people are in unhealthy relationships, which, it could be ugly. It can turn negative. Part of, when I talked about manipulative behavior, sometimes you see, individuals in domestic violence relationships that there is, a manipulation that is taking place. And one of the things that, I would see is individuals whose self-esteem had been shattered, and felt as if, this is, it'll get better, or it's okay. I think that anytime there is violence, in any relationship, we need to
Mhm.
step away from that relationship,
Mhm.
because there is nothing and no one worth our emotional health or our physical health. But that's really difficult when you are in a domestic violence relationship. That's why it becomes a difficult question to answer. You cannot tell a person in that relationship you must leave, because if you don't have a solution and you don't have the money to secure them, then
Yes.
their concern, and especially if they have children, might be, yeah, you can tell me to leave, but who's going to take care of my babies?
Yes. Yes.
How am I going to survive? I may be in this situation, but it only lasts for a short period of time.
Yes.
So we have to be really careful about our judgment of individuals when they go through these very difficult situations. And that's why it becomes very important that we deal with it from a young age. If
Mhm.
we learn how to communicate effectively with others, and we teach our young children how to communicate effectively with others, and we teach our young children what healthy relationships look like and unhealthy relationships look like, and our young children grow up with this self esteem, this self worth, then it might be, and I'm not saying that it will, but
Yes.
it might be possible that when they get in a situation before it even gets to that point, that they begin to recognize, this does not feel good to me. I know my worth, and therefore I will not allow myself to be put in this situation.
Mhm.
That might be something that could keep that domestic violence situation from happening, the
Yes.
relationship from happening.
Yes.
So, I tread very carefully, because I dare not place judgment on anyone who is in a domestic violence situation saying you should get out. Because if you don't know, of course, we want them out, we want them safe,
Yes.
whether it be male or female, we want them to be safe. But until we have the resources that they need to create a safe environment, it's good to say what you say, but you don't have anything to back it up. And most people they don't want to be in a domestic violence situation.
Yes. Yes.
So if they had another way, they wouldn't be.
Mhm. Mhm.
So
That's
yeah.
true.
So
That's
I
true.
hope I answered that.
Yes, you did. Yes, you did. Because in our line of work, yours and mine, and the years that we worked together, we've come across cases like that.
Yes.
And it wasn't necessarily an easy decision to help
Yes.
that parent make because
Yes.
of all those other surrounding circumstances
Yes.
that the parent may not even have any control over. So
Yes.
I understand. I understand. Let me
Well,
ask you this one before we kind of move on.
yes.
Is there such a thing as with the domestic violence where it actually begins to develop a pattern? Like if the children come up in a certain environment, do
Oh, yes, ma'am. Oh, yes, ma'am. When you say pattern, and it's not something that you would just sit and say, uh-huh, I see that.
yes.
What you see is, so I think about the behaviors that occur in a relationship that is, a domestic violent relationship.
Yes.
Call it intimate partner violence, right?
Mhm.
And so you have physical, and you have mental, and you have verbal abuse, right?
Yes. Mhm.
And so, just think of it this way, and this is a thought that comes to mind for me. Um, I'm using this example because if you have a male female relationship, and you have either the male or the female as the perpetrator, male
Mhm.
or the female being the victim, and you have children in the home.
Mhm.
Children are learning behavior because we set the example of behavior, what behavior looks like. And if we are verbally abusive, what I have seen is young people they may not know the meaning of the words that they use, but because they heard those words, they repeat those words. And sometimes they repeat them appropriately,
Yes.
in a setting. They say, because they know what anger looks like. They may not be able to say, I'm angry. They know what anger looks like, and they know what anger sounds like in
Yes.
their world.
Yes.
And so we hear those words repeated. We also and this is a big thing, because we and I'll speak for myself, because I can stay clean if I speak for myself, right? So
Okay.
I grew up and I got spankings.
Mm-hmm.
Okay. And so in today's society, now I didn't have those brutal spankings, right? But still, in today's society, we talk about children live what they learn.
Yes.
And those spankings, depending on what they look like, could result in violent behavior.
Yes.
And so what I talk to parents about when I'm doing parent trainings or working with parents, I always say, what does the definition of discipline really mean? It
Mm-hmm.
means to teach. See, when we're brought up, I was brought up with a spanking. That was discipline,
Oh,
because
yes.
the idea was I was supposed to learn what not to do.
Mm-hmm.
But when we learn how to effectively communicate with children, when we put those expectations out there, one of the things that I always tell parents is use words like, if you don't want a child running in the house, don't say words like don't run. Use words like walk. What
Mm-hmm.
is the expectation?
Yes.
What are you expecting them to do?
Mm-hmm.
And so if they're upset or angry, they see you hitting, they see you yelling, they see you screaming. That is
Mm-hmm.
what they're learning. That is what they do. If
Mm-hmm.
it is not corrected at a young age, and what I mean by being corrected is being taught a different way, then
Yes.
this becomes, again, my internal working model. This is how I see and interact with the world. And so if I get upset or angry, you just deal with it, because I'm gonna
Yes.
say what I want, do what I want, and act like I want to act, whether it's appropriate or inappropriate. So
Yes.
yes, Miss V, I do believe that you can see patterns repeated. And it's not until someone says, hey, wait a minute, there is a different way. If I can show you a different way, would you be willing? Because I would venture to say that most parents are not trying to abuse their children.
Yes.
They're thinking they're disciplining their children.
Yes.
And in
Yes.
some communities, I would rather discipline you than you end up not coming home tonight.
Yes.
We
Yes.
have
That's
all
true.
these things that we have to look at. We have to look at cultural differences, and
Yes.
how children are being reared, and what disciplinary practices are implemented. But again, I say that you can talk to children, give children what that expectation is to change their trajectory.
Mm-hmm. Yes. That's true. That's true. And that is, I jotted that down. Children live what they learn.
Yes,
So
ma'am.
that's a very powerful statement. And I think I'm going to steal it from you and I'm going to use it a little bit. Okay.
Yes, ma'am.
Let me ask you, a master manipulator,
Mm.
can that person drift into some of these other personality disorders? Is that
Oh, yes. Oh,
okay?
yes, absolutely. Anything, so it's like this, Miss B, anything that is unaddressed can get worse. When
Okay.
we look at our own health, if we're walking around with a health issue, if you do not address that physical health issue, it is likely to get worse.
Okay.
And the same thing with our mental health and mental illnesses. If we dismiss them, act as if they're not happening, then, or just choose to, I don't have a problem, you deal with it.
Yeah.
Well, I'm not acknowledging that there is a problem, and therefore I'm going to continue doing what I'm doing. And yeah, I would definitely say if it's not addressed, it can get worse. And it can, I- I'm as far as a personality disorder, yes. As
Mhm.
far as, if you say like a mental illness, like um, well, even with schizophrenia, with schizophrenia, the treatment modality is medication and talk therapy,
Yes,
and if an individual says, I'm not taking my medicine, well, talk therapy is not going to really work
yes,
because it's in combination with, because with schizophrenia you're dealing with seeing things that other people can't see, hearing things that other people can't hear. And so if you are having these auditory or hallucinatory experiences, you're not going to really want to sit down and talk to me. And the medication is designed to help balance the chemicals in the brain. And many people who take their medication, and that is what is so key, to have a mental illness, that is what it is. It's a
yes,
diagnosis, and there is a treatment that can help an individual live a normal, healthy life.
yes,
But we have to, get to a place of understanding that just like I'm going to take medicate if I get a cold, some people ride that cold out. And
mhm,
it might go away, it might get worse, it might turn into pneumonia or something.
yes, yes,
But if I have a diagnosed mental illness and the treatment modality for that is a specific medication, there are two things that I say. I say have an active communication with your provider, with your medication provider,
yes,
because what you want to be able to do is when they're prescribing a medication, you want to be compliant because the medication is designed to help you, but you also want to report how you are feeling on this medication,
yes,
because there are several medications for specific diagnoses, and this one may not be the one for you.
yes,
And so the doctor's not going to know that. The doctor doesn't know how you're feeling,
mhm,
how you're feeling physically or how you're feeling mentally. That has to be communicated so that there is a working relationship between patient, client, and physician of care.
yes, that's true. That's true.
Yes, ma'am.
Well, this has been a very lively discussion today, and we've gotten an awful lot of very helpful information.
Yes,
What would you say, Miss Alicia Richardson, would be the one thing, the one important thing you would like the audience to take from your presentation today?
wow, that can I have more than one thing, Miss V?
Yes, you may.
And I say that because my heart, in my heart, I want to destigmatize mental illness.
Yes,
I want to take away the shame of mental illness. That is my number one. Because we are all living this life, we all have challenges. Many of us need support. Supporters need support.
yes,
You know, and some of us, I think the number one complaint is trust. Who do I talk to? So find someone that you can trust, that a mental health provider, clinician. That relationship is completely confidential, except you say you're going to hurt someone, hurt somebody else, or hurt yourself,
mhm,
because we are mandatory reporters.
yes,
Our job is to protect ourselves, you, and the community. And
exactly.
so there is an expectation that we are reporting things that are hurtful to our community. But other than that, everything else that you discuss with your mental health clinician is confidential. So that frees up that somebody, how somebody's going to talk to somebody about my business. I don't want
Yes,
everyone in my business.
yes,
And
yes.
so I'm not keep telling anybody because I don't want everybody in my business. But if you
Mhm.
find a clinician, if you find a mental health provider, that person is going to keep 99.9. Like I said, that other percent, that other 0.01% is because there is a threat to life.
Mhm.
Everything else we're going to deal with.
Exactly.
Yes,
Exactly.
ma'am.
Great. Great. Well, we certainly have appreciated you today. And of course, we have appreciated our audience for their attention and their time. And
Yes.
we have learned an awful lot today about the topics that she discussed, Miss Richardson discussed along with a few others that I threw in, and she discussed right along with them.
Yes.
So we do wish the very best for you, Miss Richardson, and you do have your own private counseling. Do you want to tell us a little bit about that before we sign off?
Sure, yes, ma'am. Well, I am Heart of the Matter Counseling, and like I said, my approach is really a wellness approach to walk alongside the individuals that I work with to support them on their journey. The work is not mine; it's theirs, but I support them, and we talk about what possibly could help them reach some of the goals that they want. I am providing services at this point virtually. I'm not doing any face-to-face sessions right now, but I am doing virtual support. So my number is 251-753-0668. If anyone is interested in a consultation to discuss whether or not services could benefit them and whether or not I'm the provider that can provide the services for them. Because again, counseling, because I think it's a very intimate relationship, because if it's going to be effective, the client is going to be honest about everything that's happening that they want to change in their life. You know, if you keep on telling those same lies, you keep on getting the same results. And
Exactly.
so my belief is that if you're willing to work, I'm willing to work alongside you, to sit with you, to discuss some of those painful things that you have not discussed, to create a plan for you to have wellness in your life. I would love for us all to be able to walk around on a bed of roses and in the clouds, but
Yeah.
that's not happening.
Mm-mm.
But I definitely do have an optimistic attitude, and we look at what things that you can put in place to change the course or the trajectory of your life.
Okay. All right. Very well said. Thank you. We do appreciate you coming and spending this time with us and bringing us such helpful information,
Yes, ma'am.
keeping us abreast of that, the
Yes,
importance of mental health and, of course, mental illness and how we recognize those things and where we go to seek some assistance, some
yes,
help with it. So
yes,
we do
ma'am.
appreciate you. And ladies and gentlemen, we are about to sign off. We do appreciate you as the audience for spending this time with us and for your participation. Next Sunday, we will give you some glimpses of the stand up mobile voter registration they had this past Saturday. A fabulous, fabulous event. And there will be some others coming up. And of course, we will keep you posted with that. So we are signing off, and we will see you again on Sunday at 3 o'clock, same place, same station, same time. Good evening.